Hello and welcome to our Friday webinar with Dr. Tom Tully. Welcome, Dr. Tully.
Hello, hello. How are you doing, Laura? And hello to all of our webinar attendees. And looking to learn a little bit today.
I am too, and I'm just curious if we'll have a stump the vet question today. Always cross fingers, something that's really outside of your wheelhouse, but then you go investigate like crazy and then you get back to us. So
That's right. Like I said, I don't know everything.
many questions, so many options.
And that, that's what being a specialist, it's like how much you don't know, right? When you're learning all of that.
That's right.
But no, so there's always that possibility, and always happy to learn and share my thoughts and medical information with the attendees. I just returned from our American Board of Veterinary Practitioners Symposium, and that's where you have avian specialists that are, that's where you get your specialty designation here in the US. And it was a very good conference, and it was nice to see many avian veterinarians there learning, and it was always interesting and fun. And it was in New Orleans too, so that was good.
Oh, that's in your backyard there, kind of, right?
Yeah, it's right down, hour away, so that's not bad at all.
Not bad, not bad. I
But
guess yeah.
I was just going to say, I wanted to, we have some of the attendees that we were talking about some of the issues that with birds as they become older, they get they get cardiovascular disease, and some species are more predisposed to cardiovascular disease than others. And through some of the webinars, it was like they had done a number of different studies that have where some of the statin agents like atorvastatin, like Lipitor, didn't reach therapeutic levels. They have done and looked, and I'm excited about this, and that they've looked at higher dosages that have not seemed do not seem to cause secondary complications or problems that appear to be reaching acceptable therapeutic levels. So for those bird owners that have birds with high cholesterol, high triglyceride, or cardiovascular disease that is diagnosed, that may be an option to treat with something like Lipitor, atorvastatin. And so that is good. I think that there's some studies, Dr. Beaufrere and Davis is doing some studies to see the effect of that and see if these therapeutic levels actually reduce the cholesterol or within the avian blood as well as it does in human blood or the system. So that's some encouraging news, on that. So I always like to share things that we have, and then about to go to a conference in Europe, and then and there is a lot of information that I've learned over the years that has always been a very beneficial resource for me to have the colleagues that are practicing in Europe and learning the medicine that they actually have found to be successful, and bring that back. And so that's I'm excited to go there and see my colleagues in Europe in a few weeks.
Oh, wow. That's a nice community of experts that you have. You guys, I'm sure it's probably easier nowadays than ever with the just the ease of Zooms and internets to
Oh yes, very
right.
much so. Very much so. but it's interesting how much, you can get just, when you're face to face or at conferences. When
Yeah.
this is more of a conference, the Zoom with meetings and looking at specific, and just really the internet has opened, everybody knows this and it's said all the time. It just, where it used to be a long distance call across the, to try to get an international long distance call, and for those that remember, that was like, very expensive and, an act of Congress. And with the internet, I mean, it's made it so much more easy. And who benefits? The patients benefit from that. So that's good.
Yeah. All right. You ready for some good questions today?
Oh, yes, I'm ready. I'm ready.
Okay.
I'm in the
Okay,
batter's box.
Just a reminder, if you're joining us and you've never done, just use if you have a question, use the Q&A button and not the chat feature button so we can kind of filter through it. So, okay. So, it's a question kind of about, I'll give you a preview. Avian CBD. Okay. So for 3 weeks, 33-year-old male Senegal parrot has been having trouble with the left leg. His feet can grab the perch. It can sit upright, but upright on a perch, but he seems off balance on the finger. X-ray didn't show any issues, no tumor, arthritis, enlarged liver. He drags his leg if he's trying to walk and uses his beak to turn around, and he's grooming. His feathers look good. He uses a platform perch as a table to eat. So he took his first flight in weeks and did okay. Sometimes his droppings look 100% like water. His fecal gram stain was off, but they're not sure of the details. He weighs 124 grams. It's like Senegal, of course. He sits on the grate and puts his beak down and tail while resting. So the minoxidil doesn't help. They started at 0.01. The vet said they can go up to 0.03. So the vet recommended trying Avian CBD, hemp well bird plus. Sorry, it's called hemp well bird relief plus, and Young Again immune and digestive support, which has been a back replacement. So what are your thoughts?
Yeah. That's a great question. And I don't think we ever get any bad ones here. But one, and this is one item I want to mention too, since you brought up back replacement. I think that there are, I've been looking and recommending, and there are a couple of, and I said I had to look into it because wasn't sure. But Necton makes really a probiotic, kind of, I think it's called Necton BioBird. And then there's also a number of products, like I think one's Healthy Gut, which is and for avian species. And not that I know, and I have that the Necton products are really, I have quality products. I've been aware of those and have used, and then they have had owners use them for many years. But any of the other products I'm not really sure about, but there are a number of promoted avian probiotic supplements out there. I just had to look. And so I just wanted to share that with the webinar audience there. And so we have the Senegal. It's not using its legs. Am I correct on that, Laura? I mean, it's having difficulty. It is going around, but it's kind of, it has a little bit of
a drag on the left.
A drag on one leg. Then one leg. But and is it consistent? Does he say if it's consistent or inconsistent? But let's just say it's consistent. And The meloxicam, no, but I have to commend, what I do have to do is commend this owner for looked, then the veterinarian, they've looked at the radiographs, the testing. Nothing has indicated any problem that would explain it. Of course, we can go into, you have a 33-year-old Senegal, it's an older Senegal, and you can look at osteoarthritis, you can look at in some type of a tumor could cause a unilateral leg lameness. You could have trauma that could cause it. You could have swelling on a radiograph that would show that. So there's a number of different things that may would have, may have caused it. You have, and then you have issues that are that you can't see. You can't test for. There may be neurologic damage. Somehow there was some trauma and it affected a nerve. There's a possibility, as we mentioned, in the statin, like Lipitor, there could be some type of a cardiovascular issue here, but it's going to be difficult to determine. So then you say, with all of these possibilities, you've done these tests, and there's nothing on these tests that kind of indicate what the problem would be, but he is not using that leg properly. And so what can you do to treat it? Well, CBD recommendation, we have looked to try to determine what the proper dose is in a parrot species, and we're still getting that information. Our original study, we just finished another study giving CBD with food and CBD without food. And the original study where we gave it without food, it was inconsistent. We have a different formulation we're using now. All CBD isn't the same. I just want to mention that. Now, this was a product, but it comes in different oils, and the different oils can have a different effect on the ability of it to be digested. In humans, it's one species, we're one, and so they have it all figured. They don't have it all figured out, but they have pretty much where if you get it, you're going to have this effect. And how well it works, I think that they're still trying to determine the efficacy of it, where people say, oh yes, it does work. Well, they're still looking at the mechanisms of why and how it works, and the consistency. So if you take it, just like if somebody takes Advil, that usually, if you take it, I take it, somebody else takes it, it all works the same. CBD is not as consistent, but we're trying to develop more information on one, we need a dose for birds, and number two, how well does it work at a therapeutic dose. But until then, because that could be many years out, and really we just started, people are using it. People are prescribing it. Your veterinarian's prescribing it. They have products for birds. I don't think that there's anything that is adverse. I haven't heard anything. Have you, Laura? If anybody using CBD on their bird, you may have heard somebody say, "Oh, I give my bird CBD" or what have you, in some avian product. I haven't heard of anybody saying, "Oh, yeah, these side effects are just terrible. You got to watch out for this or watch out for that." I think for the most part, that it's not going to hurt the bird if you give it at the dose that's given. But I don't know anything about the product, and there's many different ones out there. If your veterinarian recommends it, then they would know more about it, and they may have seen have anecdotal reports where people have found that it's beneficial, and that they've had some response. And so, and then there's some other products out there. You know, we have an integrative medicine, the service here. Integrative medicine, as I've said in other webinars, is integrating Western medicine with Eastern medicine, your acupuncture, your herbal medicine. And so there's herbal medicines that our integrative medicine service is aware of, what they do and what they were supposed to do, and the mixture to treat specific illnesses or ailments. And it would be like this case where they have a medication for lameness, lameness injuries. And so when we get to the point where you have negative, normal, but the bird is still doing it, nothing that we have, within our grasp at this point can pinpoint it, then, meloxicam doesn't work. Somebody with Onsior or Rabinocoxib don't work. The anti-inflammatories don't work. Still, then you're looking at, well, let's try something like this. If it doesn't, if the veterinarian knows the product, says, well, I haven't seen any. It's just like with Benebac. I did the research on it. I recommended it. It didn't cause any side effects. So, it may have been beneficial. We saw some evidence of that, but it's the same way with this product. Veterinarian, if he's recommending it, hasn't seen any issues or side effects. So it's not like a lot of these questions, it's not necessarily a simple answer, but you've done your due diligence in trying to find out what it is, and nothing works that is like an anti-inflammatory. It may not be an inflammation that's causing it. That's the bottom line. And that if it is inflammation, then it wouldn't work. So, then try something, it's you're in the market for something that would help work with this, and then and continue. Sometimes it takes time for conditions to show themselves, where initially when it's happening, you don't have a test, it won't show up on a test, but after a while, it does. And then, so I hope I answered the question, but I think in the end, it's like, if it's not gonna, the veterinarian knows it doesn't do any harm, or that there's any side effects. If you give something like that and the bird starts doing something crazy or not eating, or, a different attitude, stop immediately.
All right. Yeah, good advice. Okay, question about preventing or improving atherosclerosis. I got like cotton mouth today. On using fish oil as a supplement, how much and what frequency is recommended of Arctic cod liver oil for a 600 gram Timna? So would it be a drop a day? Are there other foods or supplements like hemp oil that you'd recommend feeding to prevent or improve atherosclerosis? They're shocked to hear data that the death rate of African greys from atherosclerosis is sometimes at a very young age. What do you think is the best way to try to detect it?
Yeah, that's good. That's kind of what I was talking about with the Lipitor, right? And the Torvast, and I think it was Dr. Michelle Hawkins and part of the team at UC Davis had looked and found that fish oil and flaxseed helped reduce, and again, how much, I don't know. Again, have to look back. That's been a while, but they have found that that is the case. As far as the bird is concerned, how much and how, it's not only how much you're going to give, but how are you going to give it? Fish oil. I don't think that that's necessarily going to be a tasty thing for birds. And so it's how you would do that. And also flaxseed. I don't think that's high on the list of what a bird would normally eat, right? Well, here's your flaxseed. Take this teaspoon of flaxseed, what it does is it shows that, the research was very important, but it's, if you're going to do this, is to how you can actually administer it. And just being able to prescribe, that's the challenge that we face, is like, we have this medication, we have these therapeutic agents that we can give, supplements or what have you, but we always have to consider how the bird is going to, how it's going to be administered. How is the bird going to be getting that dose of whatever it is? And so if a bird doesn't get the medication, then it's not going to get better, or it's not going to derive the benefits that you're trying to achieve. So when you look at this fish oil, yes, as far as like I said, I think that was Dr. Hawkins at Davis, fish oil and her team, and flaxseed did. So there are things out there, but I don't know how you would actually get that into the bird. I mean, you can, some birds may like it, and some birds may take it, others will not. I don't think that there's anything that avian wise, but and that's always something to consider. I don't have the dose on that. That's one thing that I can look up, Laura,
Oh, there we
next
go.
time, just to kind of see what the fish oil and dose, is for that would be recommended. How much it would affect or not, I'm not sure. Most of the birds with and there was a concern about atherosclerosis, and that is a tongue twister, right? Just it's difficult to spell as it is to pronounce, but atherosclerosis is something that we see in older birds for the most part. It doesn't mean that young birds aren't affected, but if you have it on a routine diet, and that would include what I would say is basically a foundation of a pelleted diet, and not in combine that, as I've always said, with diversity, seed in there, and some seed, and we're not talking fatty nuts, okay? And if you minimize that, then and does that mean never to feed it? No, but it means, like, just don't feed them macadamia nuts as a sole diet before they get vitamin B12 deficiency. But what it means is to do things in moderation. So there are, to answer the questions, there are I guess there's a study, at least one, in some, and possibly in chickens. There's some studies as far as fish oil and also flaxseed as it would relate to reducing cholesterol levels. The significance between species and how much, I don't, is still unknown, but it would be possibly beneficial on that. As I mentioned, atorvastatin is something that is looking promising at reducing cholesterol levels if that is found to be high in triglyceride levels at a dose of 20 milligrams per kilogram twice a day orally. I know that. The other thing is we have this, but it's, again, when you're looking at supplements like this, fish oil, flaxseed, how are you going to get that in the bird on a daily basis? Because the bird isn't, as I mentioned, that's always something you have to consider when you want to give it. Just putting it in the water or over the food, it may make it unpalatable for the bird, or the bird may not get the same dose if you just are going to let the bird free choice eat something like that. That's something that it's one thing to have the availability, as I said, with the medications. The other thing is administration and getting it in the bird. If the owner says, we have all of this, it's a bacterial infection, we need to treat it with this antibiotic, we treat it with this antibiotic, it's going to get better. The owner says, I can't get the bird out the cage. Now what do? Yeah. You see, and the only way this antibiotic comes is in an oral medication. So you can say, well, hospitalize it, but we're looking at supplements the same way. They're good. I mean, you may have some benefit on it, but how are you going to get it in the bird? Yeah. So anyway, great question. Thank you.
All right. Yeah, I remember trying to administer an oral through my bird, and it was like a snapping turtle. It was just,
yeah.
Yeah.
I know. I think about that every time I have the veterinarian prescribed medication for my Yorkie or my cats. Oh, here's a tablet for your cat. Okay, if I can't get it in there, it doesn't work. I know, and then I'm thinking I have to make this easier for my owners. I have to make it easier. Yeah.
Okay. We had just a kind of a rewind here. Can you give us the name of the doctor who is the vet who is studying cholesterol again? That's from Lisa.
Oh, Dr. Beaufrere, and he's at Davis. He actually was our resident here, and we were fortunate to have him as our resident, and he went to Guelph and at the Ontario Veterinary College in Toronto, and then he's at University of California, Davis, Dr. Hugues Beaufrere.
Alma mater, so go Aggies. All right.
Yeah.
So we got a question from Susan. Just letting you know about my little budgie that they posted about maybe having a broken wing. He started trying to fly, and each day got better. He's now flying and zooming around like nothing was wrong. Took about 2 weeks, and the wing looks normal, and it's not hanging down. So yeah, 2 weeks. I think that was from a previous webinar, I'm guessing.
Well, fantastic.
Yes.
Fantastic.
That's good news, right?
Yes, that makes my day. I'm telling you, we had one thing I always like to remind. I had and I think I've talked about leg bands on the birds. Just beware. I had another situation on a budgie where a leg band, I kind of keep a running tally in my head how many feet have been amputated by leg bands, and I had to unfortunately add one yesterday. and just don't notice until it's too late. And then, oh, the little bird's doing well. The little
Yeah.
bird's doing well, but I just like to remind everybody that is an unfortunate consequence of leg bands, and just that's not to say take them off, but if you leave them on, just be aware that that can happen, and they make mini microchips now, and that's good.
Oh,
And
is there a possibility if you wanted to have the leg band removed that you could bring it to a vet and do you guys have the tools to safely?
remove them all the time. Yeah.
Yeah. Is
Yeah.
it pretty like I'm the little scissors that go and try to see.
Oh, well, that is that is you bring up a good point, because leg bands are on the tarsometatarsal bone between the foot and the ankle. Okay. And know where they are, but of course there are rings around that leg. Now, it takes a special instrument and some knowledge on how to remove that without breaking the leg, fracturing the leg. Because the leg band, if you have the leg band, let's just say, well, I have, let's just say we have this letter opener from the National Aviary, and that's the leg. And so you have the band around the leg, okay? And this could be like a budgie band, which is wider. Some of them are wider. And so if you're going to cut that band, you need to make sure that that whatever's cutting it cuts it straight down. Because if you start cutting and it starts twisting, it'll break that leg. That band has to stay in one place and not twist this way or that way. So when you cut it, it has to maintain this position. Okay. And those cutters have to be perpendicular to that band and cut straight down. If you start cutting and that band starts twisting, that's when it breaks that leg.
Oof.
Yeah. And
Something not to
so,
try at home. Just
yeah. And so when you cut it, you have to use their special band cutting scissors that have long handles and a very, they bite into it. Now, big bird like macaw, big cockatoo, we use bolt cutters on those bands. Yeah. And so the bolt cutters are bigger than the bird. So it takes a little bit of knowledge so you don't injure the bird. And so I was just,
an amputation of the leg. I mean, just let's have bolt cut it.
yeah, I mean, so then you have all of the attendees going like, well, I think I'm just going to leave the band on and take my chances.
All right, yeah.
Yeah, and that's okay too.
Don't try it at home is what we're takeaway.
Yeah.
Do not try that at home. Okay. Now, Frank has a question about chop. So chop's popular today to deliver veggies and fruit, but maybe a medium for bacteria growth. So is fresh fruit and veggies option better? So would you recommend a chop or the possible bacteria growth, or just fresh fruit and veggies, wash and give?
Well, I think that anything can is a medium for bacteria growth. Okay. So, where romaine lettuce, okay, or what have you, I just romaine comes to mind. So, any of your vegetables, what have you, can have it. Now, you can say that the environment of some of the products I chop or what have you, I would say that with anything like with fresh is that, you know, you're putting a responsibility of that you're going to clean it. Okay. If you're not going to clean, if you're providing fresh food like that, like chop or fruits, not necessarily fruits, because again, there's sugar and water, but the fruits, but you can, as part of the diversity there, but vegetables, they're going to degrade. I mean, and you know how they wilt and and that is all a bacterial medium. And we live in a world of bacteria. Okay. And so you know, just prepare things properly. And if you are going to take on the challenge of feeding fresh food, to make sure that you provide, you know, clean it, you know, properly. And that's going to reduce the bacteria in there. So that's, as opposed to one over the other. I think it's more of actually making the food, preparing the food, and cleaning the cage with it. And so that's what I would say. And so I don't think one is more worse than the other. I think it's on the preparation and cleaning.
What about making like a chop and storing it in the fridge for a few days, and then is that could
Yeah,
possibly
I mean
bacteria
that's yeah. I mean
by chopping and
I mean, and of course the refrigerator is going to delay microbial growth. Okay, put a piece of bread, put a loaf of bread out on your counter, and then put a loaf of bread in the refrigerator and see which grows mold first. You know, we all know that. And so, but again, if you know, you don't want to leave something like fresh vegetables in kind of a mixed for, you know, 2 or 3 days, you know, I would say at the max, because you start getting degradation of those vegetables pretty quick. But that would be you know, I don't see anything wrong with that if prepared properly. No, no.
all right. So Nan has a question about research on a vaccine for avian flu, presumably for chickens. So they're wondering, would there ever be one available for companion birds? And if so, what would the testing process involve? So for
Yeah, well, that's good. That's a great question. No, they would never go through the process of trying to, I guess, approve a vaccine for companion birds for avian influenza. That whole process, the legal aspects and the monetary process, it's in the millions of dollars. They'll never do that. But what the benefits of that is that you look at if they do that, the avian influenza vaccine for chickens would be looked at to see what the efficacy would be in off-label use in parrots. So it's just like we used equine vaccine to treat triple E. It was a Eastern equine encephalitis virus in emus. Also whooping cranes, which is a endangered species, crane species, and so they're very susceptible to Eastern equine encephalitis. Well, they're not going to make a vaccine for whooping cranes or emus for Eastern equine encephalitis. We took the equine vaccine. We vaccinated emus on a kind of an experimental basis, knowing that, because we really didn't know what the side effects were. And we found that that vaccine was effective in emus also. And so that's a West Nile vaccine. We tested that in hawks, and it was an equine West Nile vaccine. They're not going to make a hawk vaccine or, as far as an avian West Nile vaccine. So we did find that we did get some protection with that equine vaccine. And for susceptible species, I still think, and there are other people that I don't want to, we were involved in some studies with Dr. Reddig and Dr. Ritchie at Georgia, but a number of other people have looked at that vaccine, and it's not, fully, everything's, you take it, you're not going to get have the bird have any signs or what have you, but it is protective. So when you're looking at avian influenza, and they're looking at chickens, of course, this is not the first time avian influenza has been a problem in chickens. Avian influenza has been a problem in chickens ever since I can remember. They have dug pits and have dumped millions of birds in those since the 70s. It hasn't been this variant of avian influenza, but they have highly pathogenic variants to chickens that have every 5-7 years. The eggs are going up in price because they had this problem in the Midwest or what have you. But ever since I can remember, since the 1980s, every 5 or 6 years, there's an outbreak of avian influenza that's pathogenic to chickens that they have to go through, and you can look it up. This is just one that they've been concerned about. It's problematic, and I'm not saying it's not as concerning as they're saying, but this isn't something new. This isn't like a COVID. This is just a different variant that they're concerned about. But tell the millions of chickens that have been dying since 1986 of different variants of avian influenza. So that's the one thing. It's just like a flu vaccine too. I mean, okay, we get I think this is H5N1. I don't know. It's they have outer surface proteins that's how they named the variant. This outer surface protein is different than that one. So you could have an H7N3, but this is, I think, H5N1. But nonetheless, that we make a vaccine for H5N1, and then the next thing you know, you have, H2N5. And it's like, oh, that vaccine doesn't work. We got to make it for this one. So that's some of the difficulty in making an avian influenza vaccine. We can do it for this variant, but what about the variant that, they've had about, I don't know, 8 or 10 variants since 1986. This one's a concern. And they'll make and look at it, and so but we'll see. But that's some of the issues with it. And then what we would do if before the next variant, it would be to see if this one would if this is a problem with the parrots and they have it out there, and there's some possible exposure, to see if it would work in parrot species. That's a study where you would give them the vaccine and see if they had an antibody response to the vaccine. So good question. Good question. It kind of gets, because a lot of people say, well, we have this disease, we have that disease. Why don't we have a vaccine here? Why don't we have a vaccine for PDD and polyoma? We do have one for polyoma, and it needs to be used in the proper situation, but we do have that. But beak and feather disease and things like that. Yeah.
All right. Question from Liz about two of their cockatiels has arthritis. One is 22 years old and there is 18. They both have been prescribed meloxicam for anti-inflammatory. Is there anything else they could do to help them? So with the glucosamine, uh, sorry, chondroitin or chondrot, sorry,
Chondroitin,
thank
chondroitin.
you. Thank you. Supplements be helpful for arthritic senior birds, and any other recommendations or things that they can add to their diet.
I would like to have osteobiflex for birds, I would, and again, it's one of those like with some of these supplements about getting it into the bird. You have two little cockatiels. Are these cockatiels?
Yeah.
And they're 20. Yes, I would say they have lived a very good life, and you're doing well with whatever you're doing. So whatever it is, keep it up. And as far as the supplementation, I know that again, I have to make sure that I mentioned to Dr. Lafeber, but he does have some senior bird nutriberries that I think that does have some of the omega-3 fatty acids in there, and then I need to make sure that he puts chondroitin and some of the glucosamine in some of his nutriberries for his patients, because if they are offered nutriberries, I think that they would be that would be one way you can almost be assured that they would get the supplements in there. So, but anyway, I do know that he does have some senior nutriberries, and I would, recommend that.
Yeah, I know that they do have the glucosamine in the senior bird nutriberries.
There you go.
Yeah.
And cockatiel, perfect.
Yeah. Yeah. There we go. Yeah. The omega-3 and 6 fatty acids.
Yeah.
But
Yeah.
all right, there you go. Yeah. And I think they've been asked this question before but you can feed it to it regardless of the bird. The bird doesn't have to be a senior citizen, so to speak.
No. You could feed it. Like I think the questioner about the African gray, you could feed it to the younger birds with the omega-3 fatty acids, and yeah.
All right, so we have a question.
Products already out there. Yeah.
Question about a 7-year-old 100-gram. I love that people know the weight. I mean, it's good. It's good to know the weight of your birds, right? So, 7-year-old 100-gram male cockatiel who has not been wing clipped for more than a year, so to fly and fall backwards to the floor upon trying to fly. Wait, who has not been wing clipped for more than a year to try and fall backwards to the floor upon flying to try. All feathers seem to be fully back as far as the flight feathers. So it sounds like he hasn't had the wing trim since more than a year ago, but still having kind of difficulties flying.
Mm-hmm. Mm-hmm.
Okay. I'll let you take that one. Yeah.
Yeah. Mm-hmm. Yeah. So yeah, and I mean it's gonna take him a little bit of time if those primary feathers are not in there. If all of them aren't in there, it's going to have flight restriction. Now, I don't know if all of the feathers are in, that it may take a little bit of time, but usually birds, in my experience, birds that have had their wing feathers trimmed, they know a lot sooner than the owner when they can fly. Okay. Because a lot of times they get an attitude like, hey, I'm in control now, I can fly, you can't. But I would say that I don't know if all of the feathers are in, that would be that have grown in, just because they haven't been trimmed that long. There could have been irregularities. All of the cockatiels, and parrots, they don't molt their feathers all at one time. So if your bird's missing strategic feathers, those primary flight feathers, and not all of them, but where you just can't get the lift. And 100-gram cockatiel is about average to me. I mean, you can have a cockatiel that weighs 85 grams, a small cockatiel, maybe a little less, and then you can have one up, in 110, a big one. But in general, 100 is right there in the middle.
Mhm.
That would be the only explanation I have, unless and usually you don't have, you have sometimes if you don't use it, you lose it type thing, where I'm not aware of where, if it wasn't flying, it's still flapping its wings, it's still pectoral muscles are there, the weight. I just don't think it would be due to a lack of exercise tolerance that would cause it to not fly. So that's the only thing. There's some of the strategic feathers just haven't that are important in getting lift, those primary flights. That's what the problem is.
Okay. Okay, question about a Princess of Wales parrot. Had a poop yesterday that was almost all water. They could tell that she didn't seem well, but she was eating a lot more than normal. So they gave her apple cider vinegar in her water, and today her poops are normal and she's acting normal. Could this be a prelude to egg laying, or maybe she ate something that didn't agree with her? So I mean, birds can eat something that don't agree with them occasionally, correct?
Well, yeah, just like any other animal.
Like us, right?
Yeah, they're just like any other animal that can occur. Also, as far as the urine production in a bird, they can have a urine volume without stool. A lot of the birds will actually, in the process, actually have the urine go up into the caudal intestinal tract through the cloaca within the cloacal area. There's different compartments, and they could resorb water in there. And then if the bird is frightened, or it may not have been, it could have been just like, whoa, that's all water. But it could have just been just at that time it voided just urine. And so it could be that. I'm not sure I would put anything. If you're wanting the bird to lay eggs, I would hope that would be the case, but I could not. I wouldn't say that is high as far as the probability of that being a high correlation to egg laying. Just one almost stool that or one urination without much fecal material. Like I said, it could just be because the bird was kind of excited, or got there was a little stressful condition. We'll have birds urinating if they come into the clinic because they've been and they're in an unusual position, or kind of an unusual environment that can occur within the clinic. That could have occurred here, but I wouldn't say that it's one telltale as it would relate to reproductive activity on that. Yeah.
Okay. And let's see. I think we have time for one more. Hopefully. Okay. So, oh, interesting. Do we have well-established lifespans for birds that are, in captivity? So the vet and they were talking about their older Senegals appointment a few days ago. So there is not a great deal of certainty in the age ranges that we have, because birds live long lives. They are often have multiple owners, and the later owners don't really know exactly how old their birds are. So what's your take on that? How do you know if the birds, if you have no idea and a bird comes in, the owner doesn't know how do you estimate age? fairly well?
No, I don't usually, it is, not really. I don't estimate age. I just tell them it's an older bird. If in general, if the bird has lens opacities or cataracts, usually if they're an older bird at that point, like I said, you look at, then that's usually like Amazon parrots over 30. Um, not so much your grays can have it into the 30s, like that, but also the dull feathers. And it's, we don't know what the average life expectancy is. After doing this over 37 years and seeing uh the birds and discussing and breeding, like I said, I have an idea of what their life expectancy is. But of course, the life expectancy of a human, like I always say, in the US is 80 years old, 81, 82 for a female and 79 to 80 for a male. That's the average. People live, 98, 100. Oh, I know somebody 100. Yeah, and also you have people that die at 10 years old, 20, 30, 40, 50, don't even make it to 80. That's the average. So, and so, like I said, I have a general idea on what the average is, but everybody, when they say, what's the life expectancy? It's like the lady in France always say, she lived to 120. What's the life expectancy of a human in well, it's 120 years. I don't think so. You
True.
can live that long, but the average, and so, oh, I know a bird that lives 70 years. Yeah, well, that's if it was verified, 70 years. But that's not the average, and the average in captivity is much more than the average in the wild. It is a rough world out there, and things will always want to eat you. And if you are lame, you're not, so the life in captivity is in general much longer than it is in the wild.
So in the wild, is it more predator or is it disease and predator combined?
Mainly predator and disease, and then you also have your own flock. I mean, if you're sick or something's not right, well, we don't want you trying to get predators into this area. So, there's also the social aspect within, if you're not up to snuff, so to speak. So there's a lot of factors that reduce, if you're not all in, and working on all cylinders, yeah, it's not long. No.
Wow. Yeah.
But so captivity is you have longer lifespan.
Oh, can I ask this last question? Because it's a cute one. So Susan wants to know, they're curious, how many and what kind of birds do you have, Dr. Tully? And do you have a favorite? Do you play favorites? Do you have a favorite in the flock?
No, I don't. I don't. I have a little Senegal at the house, and Senegal. My wife named Pickle, and I don't know, but it is a wonderful little Senegal, and I have 3 budgies at the house. Now, I've had a number of birds over the years, but those are the birds at my house, and then I have my Hispaniolans, Amazons here, that we do studies with, and it's to try to learn more about the birds. And so that's
Mm.
that keeps me busy. I love my budgies. And call it my living confetti. And the Senegal is, I can be away at a conference and I can come back, and that Senegal just is, it always it's ready to get out of the cage and get its head rubbed.
Aw.
It's getting
Who's
some new feathers today. I just found out. So yeah.
who's the bossiest of your bunch? You have like a bossy one?
Uh, I have 3 budgies and I have 2 that are bosses over the other one. So yeah.
Oh,
No,
that's awesome.
but
Okay.
no, love them, love them. Birds are great. Birds are great. I tell you, every day I learn something, I see something, and they're just wonderful, wonderful animals. And yeah.
Great. Great.
Thank-
Yeah, we'll have to, yeah, that's great. And so you're heading off, you're going out of area soon, right, for another conference. So
Yes, yes, yes. Going to see what I can new things, always learning and getting better with my colleagues in Europe. Yep.
nice. Okay. I got announced today's giveaway winner. Because we do these awesome giveaways, Lafeber does. And that is going to go to Adele Tilton. Congratulations to you and your bird. And I think we're gonna give away tropical nutriberries as well as another Lafeber product of your bird's choice. So
Thank
congratulations.
you, Adele. Congratulations very much.
Yay. And then also, so next Friday we're gonna be on with Dr. Lamb. Dr. Stephanie Lamb is going to go over wild bird diseases. So can they affect your flock at home and all that good stuff? So that'd be an important topic because avian flu is going around. I mean, just seems like there might be some tie-in with that too. So join us next Friday with Dr. Lamb. Dr. Tully, we'll see you again. We'll maybe, is it post-conference when you head out? So this will be interesting when you head off for.
When do I? Oh, I head out.
Yeah, you're right.
15th, yeah, on that. But I don't know. I think, do we have and then we have the AAV conference, but yeah, and I'm thinking of all of the little birds I saw today, and I just made it to the
Webinar.
webinar just in time. I was like, whoa, I don't know, but I did.
I am so glad you're here because I wouldn't be able to answer any of these questions, and I'd be.
It would have been atherosclerosis, right?
I would just be saying trying to say the same word over and over again and messing it up miserably each time.
No, but we'll be, I think in June, we have something in June sometime, I think before the AAV, but I look forward to it. Summertime, it'll be great. And look forward to another fantastic webinar. I just want to thank everybody for attending and all of the questions, because every time somebody asks a question, it's something we all learn and get with. I'll look at the fish oil dose, but again, with the senior nutriberries, that's something that you can do right away. So there you go. Thank you, Dr. Lafeber.
Oh yeah, always looking out for those birds.
Yes.
And thank you for I'm expecting you to fly into the Zoom screen with like surgical gear on. You're like, I just took care of a like
almost did today.
It's amazing. Like people, I don't think it kind of sits in that you're like coming from like a busy bird day like into our webinar. So we totally appreciate that. Yeah.
That's awesome. The case.
Yeah. All right.
Oh, thank you. All right.
Well, you have a great week. All right, everybody. On that note, thanks again, Dr. Tully. Everyone have a wonderful weekend. All the best to you and your flock. Until next time.
Thank you, Laura. Thank you so much. Thank y'all, everybody.